या तो उसने मुझे तुम इतना बता दो कि मैं इसको स्टॉप कर दूं, फिर या तो मैं तुझे कॉल कर दूं। ऐसा कर लेते हैं, एक दो बार आना पड़ेगा।
यहीं पे
तो 100 रुपये स्टार्ट हो गया। स्टार्ट कर दो। Good morning. Nutrition in children. Today we will discuss about what is the importance of nutrition in children for growth and development. Nutritional status of children during the critical period is of paramount importance for later physical, mental, and social development. What are the outcomes of inadequate diet? Poor growth of the child, poor cognition, poor muscle development, reduced work capacity, poor social development, high rates of illness, difficulty in school. Now, what is the definition of nutrition? Which type of nutrition we should take? Nutrition is defined as the process of providing or obtaining the food necessary for health and growth. Now, different nutrients including water, protein, cholesterol, fat, vitamins, minerals. Water, the main function of water helps in dissolving and carrying nutrients, remove waste products, and regulate the body temperature. Protein builds new tissue, antibodies, enzymes, hormones, and other compounds. Cholesterol is very important role. It provides energy. Fat provides long-term energy, insulation, and protection. Vitamins facilitate use of other nutrients involved in regulating growth and manufacturing. And minerals helps in growth of bones and teeth, aids in muscle functions and nervous system. Nutrition is of two types mainly, the macronutrients and micronutrients. Macronutrients like carbohydrate, proteins, fats, and micronutrients like minerals, vitamins. Now carbohydrate is of three types, monosaccharide, disaccharide, polysaccharide. And protein is of two types, complete protein, incomplete protein. And fat is also two types, saturated, unsaturated, and which is followed again polyunsaturated and monounsaturated fat. You should take. Micronutrients like minerals, vitamins. Vitamins is of two types, fat soluble vitamins and water soluble vitamins. Now, how much water we should take and what are the calorie requirement for the day? In the newborn period, first release, body requires water 80 to 100 ml per kg and the calorie requirement is 120 calorie per kg. First 3 to 10 days, it requires water is 125 to 150 ml per kg and calorie required is 120 calorie per kg. 50 days to 3 months, 140 to 160 ml per kg and calorie requirement is 120 calorie per kg. 3 to 12 months, 150 ml per kg and calorie requirement is 100.5 to 110 calorie per kg. 1 to 3 year, 125 ml per kg, water required and calorie requirement is 100 kilocalorie per kg. 4 to 6 year and 7 to 9 year, water requirement is 100 ml per kg and 75 ml per kg, while calorie requirement is 90 calorie per kg and 80 calorie per kg. 10 to 12 years and 13 to 15 years, water requirement is same 50 ml per kg and calorie requirement is 70 calorie per kg and 60 calorie per kg. And 60 to 19 years, the same 15 ml per kg water requirement and calorie requirement is also. But in adult, water requirement is 50 ml per kg in a day and calorie requirement is 40 calorie per kg. Now, energy made available in body in four basic forms: chemical, mechanical, electrical, and thermal. Chemical is for synthesis of new compounds, mechanical for muscle contraction, electrical for brain and nerve activity, and thermal is usually for regulation of the body temperature and maintains metabolic levels. Now, carbohydrate. Carbohydrate is cholesterol. Major source of energy is 50 to 60% requirement for the body. Carbohydrates like simple sugar, complex sugar. Simple sugar like monosaccharides, disaccharides, polysaccharides. And complex sugar like starch and fibers. Starch means amylopectin, amylose, fibers is soluble in. Now complex carbohydrates provide vitamins, minerals, and fiber. Food like bread, legumes, rice, pasta, and starchy vegetables contain complex carbohydrates also. Cholesterol, carbohydrates are main source of energy and supply bulk in. They contribute taste and are essential for digestion and absorption of food. Carbohydrates play an important part in nutrition as they spare protein to be fully utilized for growth and various requirements. All carbohydrates are ultimately oxidized and converted to glucose. Glucose is used as a fuel in a body by brain and muscle, converted into glycogen and stored in liver and muscle. Source of carbohydrate in fats diet is found in the form of lactose in both human and cow milk. That should be provided up to 6 months. Lack of adequate carbohydrate may produce symptoms of starvation, undernutrition, constipation, and loss of body protein also. Now, what are the function of carbohydrate? The most important, it provides energy, obviously facilitate digestion of the fats, spares proteins, contribute to structural element of the body. It provides palatability and sweetness to food and furnishes dietary fiber for normal peristalsis. Now, what is proteins? How much requirement for the body? It is the first nutrient of the first importance of the body. Also derived from Greek word, first classification is essential amino acid and non-essential amino acid. Functions main important is growth, repair, and maintenance. Essential component of enzymes and hormones. Transport molecules, immunoglobulins, source of energy. Sources in cytoplasm cell membrane, mammalian muscles 20%, blood plasma 7%, cows milk 35%, cereals 12%, and beans, nuts, pulses like 40%. Non-essential amino acids, those amino acids that can be synthesized in the body. Essential amino acids required to be supplied in the diet, like leucine, isoleucine, lysine, methionine, threonine, threonine, tryptophan, valine, histidine, and arginine. Now, what is this term protein quality? Depends on their amino acid profile and digestibility. It provides 4 kilocalorie energy per gram. Egg protein has highest value to biological value and net protein yield. Fresh protein take it 100%. And in requirement, net protein yield is 65. Now, daily nutritional requirement recommended dietary allowance for Indian children. It's different in different age group. Like less than 6 months, energy 92 kilocalorie per kg, protein 1.16 gram per kg, calcium 500 mg, iron 46 microgram per kg. 6 to 12 months, energy 80 kilocalorie per kg, protein 1.69 gram per kg, visible fat 19 gram, calcium 500, iron 5 mg, zinc 5. 1 to 3 year and 4 to 6 year, energy is 1060 and 1350 kilocalorie per kg. Protein is 16.7 gram and 20.1 gram. Visible fat is 27 and 25. Calcium approximately 600 in both age group. Iron 9 mg and 13 mg, and zinc is also same. Say boys 10 to 12 year and girls 10 to 12 year. It is different. Energy is 2190 kilocalorie. In boy 39.9 gram protein, 35 visible gram in visible fat and 600 calcium. 16 mg iron, zinc is also 8 mg, girl 2000, but 2010, protein is 40.4 gram, visible fat is 35 gram, calcium is 800 mg, iron is 37, zinc is 11, and 13 to 15 year, boy and girls 2750, in boy 2330 calorie, 54.3 gram protein in boy, 51.9 gram per kg in female. 45 visible fat in boy and 40 in girl. Calcium requirement say to 800 mg. And iron also 32, 37. Zinc is also same 11. And boys is 16 to 17 year and girls 16 to 17 year. Energy requirement is 3020 and 2240 girls. Protein 61.5 gram and 55.5 gram in females. 50 gram visible fat in boy and 35 gram visible fat in girl. Calcium requirement in both 800 gram. Iron 28 mg in boy, 26 mg in girl, and the zinc is same 12. Now vitamin A. Vitamin A, B1, B2, B3, B6, folate, vitamin B12, and vitamin C. The less than 6 months, vitamin A is 350 microgram. Vitamin B1, zero point 0.2 mg. Vitamin B2, zero point 0.3. Vitamin B3, 710 microgram per kg. Vitamin B6, 0.1 mg. Folate is 25 microgram. Vitamin B12, zero point 0.2 microgram. Vitamin C is 20 mg. 6 to 12 months, the same 350 is vitamin A and vitamin B 1.3, B 2.4 mg, vitamin B3 650 microgram per kg, B6 is zero point 0.4, folate is 25 microgram, vitamin B12 is zero point 0.2 microgram, and vitamin C is 25 mg. 1 to 3 year and 4 to 6 year. The vitamin A's requirement same 400 microgram and vitamin B 1.5 and zero point 0.7 mg, vitamin B2 zero point 0.6 mg and zero point 0.8 mg, vitamin B3 is 8 and 11 mg, vitamin B6 is the same in both age group 0.9 mg, folic acid 80 microgram in 1 to 3 year and 100 microgram in 4 to 6 year. Folate is 100 and 120. B12 is same the 0.2 to 1 microgram. The vitamin C requirement is 40 mg. Now 7 to 9 years, 600 vitamin A is required and vitamin B1 is zero point 0.8 mg and 1 mg is vitamin B2 and B3 is 15 and B6 is 1.6 mg. Folate is 140 microgram. B12 the same 0.2 to 1 microgram and vitamin C requirement is the same 40 up to the 17-year-old. Now boys and the year of boys and girls. Up to the 17 year and both 600 microgram vitamin A requirement. And vitamin B1 is 1.1 to 1.5 microgram. And vitamin B2 is 1.3 to 1.8 microgram. And the vitamin A requirement, the same 600, and folate is 200, vitamin B12 is 0.21, and vitamin C. Fat. Fat provides 9 kilocalorie of energy per gram, about 25 to 30% of energy. Fat supplies 40 to 50% energy needed for the infant. It provides protection and supports organs and insulation of the body as adipose tissue. It is carrier of fat soluble vitamins. Fat and oils are concentrated source of energy and make the food palatable. Fats and oils are termed as lipids. Now, simple lipids like saturated fatty acid, unsaturated fatty acids. Saturated fatty acids like ghee, butter, coconut oil. Unsaturated fatty acids like monounsaturated fatty acids and polyunsaturated fatty acids. Monounsaturated fatty acids like olive oil, palm oil, groundnut oil, mustard oil. And polyunsaturated fatty acids like corn oil, soybean oil, sunflower oil. And essential fatty acids like linoleic acid and linoleic acid. Saturated fatty acids sources like meat, egg, milk. Unsaturated fats commonly found in plants and fish. Polyunsaturated peas, beans, wheat, cereals, nuts with meat. More fat intake in diet can cause indigestion as it remains longer in the stomach. Deficiency of all fatty acids may result in growth retardation, skin disorder, susceptibility to infections, neurological and visual problems. ICMR has recommended a daily fat intake of 25 grams per day in young children and 22 grams per day in older children. Now triglycerides. Medium chain triglycerides is 6 to 12 carbon length and long chain triglycerides more than 12 carbon length. Sources like coconut oil, palm kernel oil, and butter 14%. The main function of triglycerides, it helps in endurance performance, promote fat burning, spare muscle glycogen, and increase amount and lower blood cholesterol. Uses like cystic fibrosis, pancreatic insufficiency, aquatic deficiency syndrome, AIDS, epilepsy, cholesterol, high blood cholesterol, fat malabsorption, intestinal activity, and act as energy supplement in athletes. Now, essential fatty acids is a group of fatty acids that are essential to human health. Omega 3 linoleic acid, omega 6 is linoleic acid. Now, what are the functions of essential fatty acids? Helps in formation of healthy cell membranes, proper development and functioning of the brain and nervous system, Production of hormones like substances called eicosanoid, thromboxone, leukotriene, also for regulating blood pressure, blood viscosity, vasoconstriction, immune inflammatory response. Now, omega-3 fatty acid sources like walnuts, wheat germ oil, canola oil, fish liver oil, human milk, organ meat, seafood, alpha corn, tuna, mackerel, salmon, sardines. Benefits. What are the benefits of omega-3? They have lower prostaglandins, anti-inflammatory, low triglyceride, cholesterol levels, cancer prevention, renal maintenance, increase insulin sensitivity, enhances the thermogenesis and lipid metabolism, benefits vision and brain function, decreases skin inflammation, and inhibits hereditary emission. Now, what are the sources of omega-6? Like corn oil, peanut oil, cottonseed oil, soybean oil, many plants oil. Benefits, especially omega-6 fatty acids, the high GLA content may help it reduce inflammation of rheumatoid arthritis, relieve the discomfort of PMS, endometriosis, fibrocystic breast, reduce the symptom of eczema and psoriasis, clear up acne, prevent anti-neuropathy, and helps in cardiovascular disease and cancer also inflammatory. Essential fatty acid deficiency what affect the body like enriched blood pressure, high blood pressure, high triglycerides, immune and mental deficiency, impaired growth, weakness, dry skin, scaly dermatitis, impaired vision, tingling sensation, mood swings, edema. Now, energy needs of the body calculated by some food factor like basal metabolism, energy for physical activity, energy used for body heat, specific dynamic action of food. Now, what is balanced diet? It is the one type which contains varieties of foods in such quantities and proportions that are needed for the energy. What is RDA? Recommended dietary analysis. Nutrient amounts in excess of what 98% of the population required to maintain health. Now VMR is the number of calories expended by the organism per square meter of body surface. Normal BMR value for different age group like 5 year, 10 year, 15 year, 20, 30, 40, 50, 60 years. Calorie requirement is according to the age 53 kilocalorie, 10 year 49 kilocalorie, 15 to 20, 40 to 46 kilocalorie, 30 year of the age 39 kilocalorie, 40, 50, 60, 38, 37, 35 kilocalorie. And female ratio is 51 in 5 year age group, 46 in 10 year age group, 36 to 40, 50 to 30 year age group, and 33, 34, 36 kilocalorie in 60 year of age group, 50 year of age group, 40 year of age group. Now, recommended dietary allowance liquor amount in excess of what? 98% of the population required to maintain health. They are not minimum requirements for optimal intakes for all people. Average daily intake energy and nutrient level intake estimates for healthy body. No conception of dietary for food and nutrition, no guided difference. It is also different in different age group. Calcium, phosphorus, magnesium, vitamin D, fluoride, thiamine, riboflavin, niacin, B6, folate, B12, pantothenic acid, biotin, choline, vitamin C, vitamin E, selenium. In different females, 1300 in calcium, 1250 phosphorus, 360 vitamin D, 5 fluoride, thiamine 1, riboflavin 1, niacin 14, vitamin B6 1.2, folate 400, pantothenic acid 2.4, vitamin 25, choline 400, vitamin C 65, vitamin E 50, selenium 55. 19 to 30 year requirement in females like 1000 in calcium, 700 phosphorus, 310 magnesium, 5 mg is vitamin D, 3 is fluoride, thiamine 1.1, riboflavin is 1. Values given in all the milligrams and as called calcium 1 mg calcium is equal to 40 grams of unit vitamin D. Now, what are the vitamins? Vitamins are organic substances and essential micronutrients for health. Vitamins enables the body to use other nutrients and help in maintenance and production of good health. Vitamins are classified into two groups: fat soluble vitamin and water soluble vitamin. Vitamin requirement of individual child may vary with activity, age, body weight. Vitamin requirement is more in preterm babies. Infants get adequate vitamins from mother during lactation. Now, what are the minerals? Minerals are inorganic element required by human body for growth, repair, and regulation of vital body functions. Well balanced diet is a sufficient quality of minerals. Minerals are required for maintenance of osmotic pressure, supply of necessary electrolytes. Minerals are classified into macro minerals when the daily requirement is 100 mg or in micro minerals when the daily requirement is less than 100 mg. Now, minerals like iron in different in age group, like infant in 1 to 3 year, 4 to 6 year, 1 mg per kg, 1 to 3 year, 12 mg per kg, 4 to 6 year, 18 mg per kg, 7 to 9 years, 26 mg. More separate. 10 to 12 year boys is required 34 mg because of 19 mg. 13 to 15-year boys 41 mg minerals required in girls 28 mg. 16 to 18 years boys 50 mg required in girls 80. Calcium infant 500 mg required. 1 to 9 year, 10 to 15 year, 16 to 18 year, it is like 400 mg, 600 mg, and 500 mg. Iodine is 0.2 mg, sodium 2 mg per kg, potassium 1.5 mg per kg, zinc 0.3 mg per kg, copper 0.5 to 1 mg per kg, fluorine 0.5 to 1 mg per kg. Now, what are the deficiency of nutrient physical development? Micronutrient deficiency suppose vitamin D and calcium affect bone development. Potassium, zinc, magnesium, copper disturb the growth hormones and affect growth. Manganese deficiency leads to skeletal abnormality, including retarded growth. And vitamin E deficiency affects muscle development. Now, deficiency vitamin B1 affects the body like reduction of brain content of neurotransmitter and the level of brain GABA, glutamate, aspartate. Vitamin B12 impaired performance on psychomotor tests, neuromotor incoordination, and personality changes. Vitamin B3 loss of memory, nervousness, easy distractibility, and schizophrenia. Vitamin B6 affects the body like depression, irritability, loss of memory, inability to concentrate, peripheral neuritis. Vitamin B12, loss of memory, disorientation, and emotional instability. Folic acid affects the body like memory loss, forgetfulness, depression, irritability, introversion, lack of confidence. Vitamin C reduces score for IQ, memory, abstract thinking, and non-verbal intelligence and blood behavior. Vitamin E, poor memory, and attention span and skin problems. Vitamin A micronutrient deficiency it impairs it impairs immunocompetence, therefore it can increase the risk of infection. Vitamin E impairs several aspects of immune response, including B and T cell immunity. Vitamin C impaired inflammatory responses and function of phagocytes. Zinc impaired lymphocytes responsiveness and T cell development. Selenium impaired antibody production. Now, what are the sources of vitamins in the food diet? B1, B2 like milk cheese, B12 milk product, B45 milk cake disease. A very rich source carrots, broccoli, asparagus, seeds, cabbage, broccoli, green leafy vegetables. And potassium like sprouts, colors, like B6 carrots. A अभी नहीं कैसे stop करें? A liver, B1 legumes, beef like pork, B12 is meat, egg, niacin, B6 banana and it has C is grapefruit, orange, strawberry, polycin oranges. Now, what are the nutritional research? How to assess the nutritional risk? Patient complaining occasionally medical and social histories. We should take proper dietary history evaluations, physical examination like anthropometric is very important. Pertinent. Lab test obviously. Now, what are the complaints? General weakness, chronic fatigue in children, loss of appetite, very common feature, painful bleeding gums, loss of weight, sore legs, tongue, so irritability, loss of ability to concentrate, loss of manual dexterity. Guidelines. What are the guidelines for pediatric nutrition? Infants will be exclusively breastfed food for 6 months. After 6 months, provide nutrients which are easily digestible, contains various antibodies which have to build immune system. Never overfeed or force the child to eat. Introduce new foods at regular interval to increase acceptance of new foods. Provides small frequent foods. Provide food in colorful, evening way. Balance food with physical activity. Provides plenty of grains, fruits, and vegetables. Low-fat dairy products. Never stop breakfast. Involve the child in making food choices. Now, how to counsel for the children about the nutrition. Important responsibility of the pediatrician and pediatric nurses to nutrition counseling guidance to the parents, caretaker, and also the children with the goal of achieving optimum nutrition throughout the year of development. At 6 months, Complementary feeding should be initiated with fruit juices, new food to be introduced with vegetables from mashed banana, mashed and boiled potato, etc. Each food should be given with 1 or 2 teaspoons at first for 3 to 6 times per day. Now, 6 to 9 month food item given in this period including soft mixture of the rice and dal. Pulses, mashed and boiled potatoes, bread or roti soaked in milk or dal. Mashed foods like banana, mango, papaya, stew, apple. Egg yolk can be given from 6 to 7 months onwards. Curd or kheer can be introduced from 7 to 8 months onwards. 9 to 12 months, new food item like fish, meat, chicken can be introduced during this period if they are a non-vegetarian. Feeds should be soft and well cooked. Spices, condiments to be avoided. Breastfeeding to be continued. Now, what is the conclusion if we advise the nutrition? Adequate knowledge, attitude, practice of application of nutritional requirement must be the basis of infants treating the health and nutritional status of the infant and subsequent growth and development through childhood depends upon successful feeding practices. Nutritional counseling is the important responsibilities of the nurse to promote the nutritional status of the children and to prevent nutrition deficiency disease. 12 to 18 months, the child can take all food which cooked in namely and needs half amount of the mother diet. Number of feeds can be 4 to 5 times according to the child's need, but still breastfeeding to be continuously at night. Its conclusion, adequate knowledge, the same factors. What are the factors to be considered while planning food for the child? Required energy density, how much the amount of feed we should give, consistency of the food, frequency of feeding. And the hygiene is very important role in proper maintaining growth and development of the child. So we should clean, wash hands properly first before giving the food to the child, and it may also help the child. Thank you. हाँ, ध्रुव आ जाओ। लेकिन मैंने इसको बंद किया था यार, स्टार्ट ये वीडियो को पॉज कर दिया था। एक बार देख लिया आ भी रहा है।